观众朋友，大家好，欢迎收看本期的最佳方案。在上一期的节目中，我们请 OCuSOFT 公司的两位副总裁特洛伊·史密斯和乔治·海尼斯给我们介绍了有关眼睑健康的问题，我们也了解了眼睑健康的重要性。那么今天呢，我们来重点了解一下跟眼睑有关的疾病、干眼症和眼睑炎。OCuSOFT 是美国最早从事眼睑健康产品开发生产的企业，目前已经有30年的历史。公司的系列眼睑健康产品市场占有率在美国占据第1位。
Well, dry eye, the clinical term for dry eye is when we talk about the 3 layers of the tear film, if there's an excess or deficiency in any one of those 3 layers, meaning that either they're producing too much oil, too much water, or they're not producing enough oil or enough water. That's the clinical definition for dry eye. Now, it can seem kind of strange because oftentimes when a person says I have dry eye, or when a person has dry eye, their eyes aren't dry at all. In fact, their eyes can be watering significantly. And so in that case, what's happened is that the oil layer, the protective layer of the tear film is no longer there. And so rather than having the eye, the tears sealed in and on the surface of the eye, they run off. Another thing that happens if the person is aqueous deficient is the oils come into contact with the mucus, and you get sort of a stringy mucus in the corners of the eye or something like that. So the proper definition of dry eye syndrome, or the actual definition of dry eye syndrome, is an excess or deficiency in any one of the 3 layers of the tear film.
Yeah, so symptoms are kind of dry, scratchy, irritated eyes, redness, burning sensation. Sometimes that's patients that are symptomatic like that, they're considered a dry eye patient. Eyes watering, excessive watering. It sounds counterintuitive. Some people don't think it's dry eye when their eyes are watering, but their eyes are watering because the oil layer or lipid layer is not intact. So it's not keeping that aqueous layer intact. So therefore, the outer layer of the tear film becomes more water-based. So you tear all day. So excessive tearing is also considered dry eye. So symptomatics or symptoms should be excessive tearing if it's evaporative dry eye, scratchiness, redness, irritation, foreign body sensation for dry eye patients.
So you can have, and actually the most common form of, it's estimated that some 80% of patients will have dry eye at some point in their life. And of those 80%, about 85% of them will suffer from evaporative dry eye, or dry eye that's caused from a lack of production of the meibomian glands, not enough oil being produced. So that's by far the most common. But interestingly, most of the artificial tears on the market are made to mimic the aqueous layer of the tear film, or the water layer of the tear film. And so you would have about 95% of the artificial tears that you would see at the store aimed at reproducing the water layer of your tears. But if 85% of the patients have evaporative dry eye, then you need an artificial tear that replenishes the oil in the tear film. One of the solutions that we offer here at OCuSOFT is known as Retain MGD. So when doctors want to treat evaporative dry eye, it's often a multifaceted approach. So they're going to use several treatments. The first treatment that they'll recommend is a warm compress. And the purpose of the warm compress is if the meibomian glands are clogged and they're not secreting the proper consistency of oil, by heating the gland, it melts the oils that are there and allows them to secrete properly. Now, the second thing that needs to happen is after these oils are secreting, the excess oil needs to be removed from the eye in order to maintain good ocular health. And then finally, you may supplement the oil production by using an oil-based artificial tear like our Retain MGD. So the product that we recommend for cleaning the eyelids is our OCuSOFT Lid Scrub Original. And what makes this product special is that it's a very mild treatment, so it's milder than even baby shampoo. And the purpose of it is to remove all oil, debris, and dead skin from the surface of the eye, allowing the glands not to be clogged anymore and to secrete properly. The way this product works, it's very simple. It comes in a box of 30 pads. So this is the actual pad. There's 30 of these in the box, and the way that they work are very simple. So in order to use the pad, you would tear it open, you remove the foam, remove the pad, and then you would just take it and fold it over your index finger and scrub gently from side to side for about 30 seconds, and then you turn the pad over on the other side and you scrub the other eye. And so by doing this, it removes all of the excess oil, debris, and dead skin from the eyelid, preventing the meibomian glands from being clogged in the future.
So there are several different types of artificial tears available in the grocery stores or pharmacies. The first generation of artificial tears are saline type tears, just simple salt and water, much like our tears that we produce. They don't have a very long retention time, so you have to use them quite effectively quite often. Those are also very inexpensive tears, but that's why, because there's really nothing extra in them to help. The second type of tears are more synthetic polymers. They're thicker solutions. They're a little bit longer retention time when you put it in the eye. Both of those tears, and all tears in general, you have to be careful because many of them contain preservatives, and those preservatives can be irritating to the eye. You can get an allergic reaction by overuse of these tears, and can cause red eye and an allergic reaction. The third generation of tears we don't have here in the U.S. It's hyaluronic acid. It's a very good tear. However, it's not available here in the U.S. The fourth generation of tears are ophthalmic emulsions, and that's what we have as our Retain MGD. It's an ophthalmic emulsion. It's a very good tear. Its retention time is better than every tear on the market. The osmolarity is low. It's a hypoosmotic, so it helps get the eye back to the normal isotonicity of the eye for patients that have dry eye. Very good product. It's also preservative free, so you don't have to worry about preservatives irritating or causing an allergic reaction with the Retain MGD.
在采访当中，我们了解到80%的人在一定的年龄之后都会出现干眼症，所以我们觉得这样的事情对每位观众还是非常重要的。同时呢，我们也了解到长时间看电脑、戴隐形眼镜都会对眼睛有所伤害，造成眼睑的油脂或者是水分泌失衡，所以这样的人群一定要更加注意保护您的眼睛。当然，除了挥发型的干眼症外，干眼症的另一种状态，油脂分泌过多，那就会造成眼睑炎。
So another condition or contributing factor to dry eye syndrome is when there's an excess of oil produced. Now this is actually a symptom of another lid disease known as blepharitis. And in essence, blepharitis is inflammation of the eye. So bleph means lid, itis means inflammation, and you put those two together and you get inflammation of the eyelid. Now most typically this is caused by an overproduction of oil. There's several different types of blepharitis. Some of them can be caused from allergic situations. You could get blepharitis from bacteria. You can also have what's known as seborrheic blepharitis, and basically that refers to dandruff on the eye. And then finally, you can have blepharitis that's caused by a Demodex infestation. And so the symptoms of this are usually redness, itching, a little bit of burning, and then oftentimes a foreign body sensation where you feel you have something in your eye. Now, the treatments for blepharitis vary based on the type of blepharitis that you have. And so the most common form of blepharitis is seborrheic, and that's treated by using our OCuSOFT Lid Scrub Original. One of the leading causes of dry eye syndrome is actually a condition known as blepharitis. And there are several different types of blepharitis. So the first type is known as seborrheic blepharitis. And this occurs when there's excess flaking or dandruff-like scales on the surface of the eye. And so because this is the most common form of blepharitis, we have a product known as our OCuSOFT Lid Scrub. And what this product does is it helps to remove the oil, the debris, the dead skin from the eyelid. So OCuSOFT Lid Scrub Original is the flagship product, the #1 doctor-recommended product for treating seborrheic blepharitis. And the reason it's so popular is first because it's very, very mild. much milder than even baby shampoo, so there's no irritation to the eye itself. Second, because it uses a surfactant, it's able to help, or surfactant or soap, it's able to help remove all of the excessive oil that's produced by meibomian glands, overproduction of oils in the meibomian glands. The product is very simple to use. In fact, all you would do is open one of the pads, you tear the pad open, you fold it over the index finger, and you scrub gently from side to side for approximately 30 seconds, and then you turn the pad over and you scrub the other eye, and then rinse, and you're done. And this process, by doing this process once a day, you're able to alleviate all of the symptoms that are associated with seborrheic blepharitis. Now, another thing that occurs if seborrheic blepharitis is left untreated, what happens is as we age, our bodies begin to produce more and more of these oils. And these oils then become a breeding ground for bacteria. And so while we are accustomed to washing our face and behind our ears and all the other parts, generally we don't often think to wash our eyelids. And so as our bodies begin to produce more and more of these oils, the bacteria level begins to increase more and more until you get to the point where there's an infestation or an overabundance of bacteria. And so in that case, we would recommend an antibacterial eyelid scrub. So this is our OCuSOFT Lid Scrub Plus. And what makes our OCuSOFT Lid Scrub Plus unique is just like our OCuSOFT Lid Scrub original formulation, it's very mild, milder than baby shampoo. It doesn't cause any irritation to the eye. It also has a surfactant which helps to remove the excessive oil and debris and dead skin from the eye. But in addition to that, it uses an antibacterial preservative known as PHMB. And PHMB is effective at killing 7 different strands of bacteria, most common to the eyelid area. And so by using this product, you scrub, and unlike the original, you leave it on. And after 2 hours, it's killed all of the bacteria around the eye. So this is great for bacterial blepharitis. Now, in addition to the Lid Scrub Original, occasionally there are acute cases of bacterial blepharitis in which we would recommend a hypochlorous acid. Now, there's 2 types of hypochlorous acid in our assortment of products. So we use a spray, and then we also use a gel, but they both function the same. And in essence, what they're to do is these are highly active against bacteria. They kill on contact with a lot of bacteria. And so if a patient has an acute case of bacterial blepharitis, then the doctor will recommend a hypochlorous acid, but they always recommend it in conjunction with a lid scrub, because while the hypochlorous acid is great at killing bacteria, it doesn't provide the soap or surfactant necessary to remove the oil from the eyelid. So it's important that the hypochlorous acid is used along with our lid scrub so that it can remove not only the bacteria, but it can also remove the oil and the debris and the dead skin that the bacteria likes to feed on.
So in very severe cases of blepharitis, what many doctors, in the past, what many doctors were doing were prescribing an antibiotic. So they would ask the patient to cleanse their eyelids twice a day, morning and night, and in the evening they would apply an antibiotic ointment to the outer eyelids to kill any bacteria, excessive bacteria that are on the lids. And this was typically done for about 2 weeks. The patient would continue on an eyelid hygiene regimen of using lid scrubs, but then would teeter off of the antibiotic. Antibiotics prices have gone up. It's become very expensive, and insurances don't cover all antibiotics. We have a product called OCuSOFT Hypochlor. It's a hypochlorous acid. Hypochlorous acid has a low pH, so it has a very high kill rate of bacteria immediately, but it's also non-irritating to the eyes. So what we recommend for those patients that are severe, use the OCuSOFT Lid Scrub Plus or OCuSOFT Lid Scrub Plus Platinum daily, twice a day. But as an adjunct, you would spray this hypochlor solution, OCuSOFT Hypochlor solution, onto the outer eyelids. It'll kill bacteria immediately as an adjunct to the lid scrub.
无论是干眼症还是眼睑炎，对普通的民众来说都是比较陌生的。那么今天通过2位专家的介绍，真的是给我们打开了一扇门一样，让我们知道了这么多有关眼睛的知识。在下期的节目中呢，我们将继续了解更多的有关眼睑的知识，白内障和眼睑螨虫。好的，观众朋友，我们这期的节目到这里就结束了，感谢您的收看，再会。